My name is Jacob Crawshaw. Currently I'm 4 months into a 4-year PhD with the Institute of Pharmaceutical Science with King's. My area of research is looking at medication adherence in cardiac patients. So the idea is to develop an intervention to improve rates of adherence, which is going to be led by a pharmacist within hospital prior to discharge. It was really important. Prior to doing my Masters, I was working in a completely different area. It was really the catalyst to change tact in my career to go down something what was going to lead into research. Fortunately for myself, I think it was a really good idea to come and do my Masters. It has led on to other things and ultimately has got me to where I want to be, which was doing a PhD. My MSc project was a secondary analysis, so there was no data collection. It was all very stats-based. It was looking at 10-year survival in a cohort of patients who'd undergone cardiac valve replacement surgery. So we were looking at whether psychological predictors would actually determine whether or not patients were still alive 10 years down the line, and compare that with the more well-researched clinical and demographic predictors. Unfortunately, the psychological predictors weren't found to be associated with 10-year survival. The clinical factors really were dominant in that respect. However, the work what I did for my MSc project has actually gone on to be published. So we actually did some further analysis looking at illness perceptions and whether they changed over time, and whether this cluster of illness perceptions, whether they predicted survival. And we found that patients who, prior to surgery, had a very, very positive perception of their illness and their treatment. When measured again at 1 year, they had actually developed quite a negative sense of their beliefs. And this subset of patients were actually, I think it was about 3 times more likely to have died compared to patients who had a really strong positive belief about their treatment and their illness throughout the 1 year follow-up. So that was quite a nice little interesting finding. Research methods, heavily. The Masters was really very focused on enhancing research methods and statistics, which may scare quite a lot of people, but the staff are absolutely fantastic at breaking it down for people with all levels of kind of like competencies with statistics. Data collection, albeit my MSc project didn't have any clinical data collection. As part of my placement, there was some data collection there, and the placements are a really good part of the Masters. What is well, when I was doing a Masters, it was unique. It was early Masters what was offering the clinical placement. Again, it was the catalyst, really. I mean, the work what I did in my MSc project that has gone on to be published. So hopefully that was the first of many to come. Working with Professor Wyman, he's actually my supervisor for my PhD. So having that good working relationship with your MSc supervisors can lead on to other things if you do work well together and put the effort in. And just the experience, really. Like I said, the placement was absolutely fantastic to gain a really good understanding. So I was working with a clinical psychologist in the context of pulmonary rehabilitation. So this is patients who had like COPD and other lung conditions, trying to get them exercising. And the role as a health psychology student was really to supplement their development and their recovery, and work really closely with the physios, which was really good. It really gives you an understanding of how to work as an MDT. Very, very positive. I did the Masters 2012-13, which was the first year where they did it separately from UCL. So I suppose we were a bit of a guinea pig year, and I think it was, all that considered, it was run very, very smoothly. Joe and Lindsay, the course supervisors, they were absolutely fantastic, and I think the outcomes of my cohort really speaks volumes for how well it's run, because I think 5 or 6 of us have gone on to do PhDs. One of the students has gone on to do health psychology training Another one's gone on to do clinical psychology, so I think that speaks volumes for how useful and I suppose the positive aspects of the course. I would, absolutely. If you wanted to go down a career in health psychology, it's absolutely fantastic. It's stage 1 accredited, so that sets you up if you want to go and do the stage 2 health psychology practitioner training, which is something what I think I'm looking to do perhaps next year or something like that alongside my PhD. So absolutely, 100%.